So sometimes, people just have a fear that they can never be a father. Like, it's just a simple example. They would fear that they may not have good sperms.
If a person is sexually active, let's suppose, but is still obsessed with masturbation, like, does that impact the both?
So basically, it does, of course, because first thing it does is that it's a made-up thing. If you see a movie, maybe a Hollywood or a Bollywood, and you start acting like the hero and start jumping the building, of course, you will harm yourself. It's pretty similar to what happens on the reels around the subject. So what happens is that you start to get exposed to unrealistic times. So you would find people who are doing it for 30 minutes, 60 minutes, and they would expect that is how long they should also be.
How common is like premature ejaculation?
Actually, statistics say 1 in 3 people. So
Hello guys, and welcome back to another episode of Mixed Fruit, and this episode will be about medical science, and specifically we have a special guest, Dr. Raman Tanwar with us, who is a urologist, and today we are talking about a lot of things regarding that, and this is really going to be an informative and fun podcast. So if you are new to this channel, please subscribe below and let's begin with it. How are you, sir?
all well. Please tell me, how can I help you guys?
Thanks for coming on such a short notice.
Yeah, and helping with the production as well.
Yeah.
My pleasure.
He owns the studio also.
Yeah.
Just putting it out there. Yeah. And yes, he helped us a lot with the setting up all of this also. So yes, how long have you been doing this?
The studio or
Both.
urology?
Both.
And urology. Of course, studio since a much longer time now. I've been a sound engineer. I've trained virtually with Berkeley. So that was, I think, somewhere around 2004
Oh,
during my MBBS.
I was
And
1 year old.
I was 3.
so that's when. And we started our first audio production studio in my room, of course.
Oh,
That was in 2005. 4-5 again.
okay.
Right. So, and then I made a full-fledged studio in 2010, which was at my home's basement, and then we've kept evolving to keep my creative side going. So now
That's
we have
wonderful.
an actual studio, and I have creators like you.
That's
So it's a pleasure. Yeah.
So you did your studying in sound?
In Delhi. Yeah. So that was a sound engineering.
Oh,
Oh, and then you shifted to.
Yes. So we had a college band. I used to play a lot of instruments.
wonderful.
So then that's when sound engineering came, because again, we were college students then,
Mhm.
and we wanted to cut short on the budgets as much.
Mhm.
So we
Mhm.
learned more, and then of course, when you become a doctor, then you get a little time for it. But then it's still some passion has kept me going. Yeah.
Amazing. You, as a doctor, I think I also have a lot of doctors in my family. They study a lot. Like a lot of years of your life goes into understanding the
so
anatomy
15,
and
yeah.
everything.
To be
15
precise.
years. How did you make time for sound engineering as well as doctor?
It's basically once you're bored with studies, you can move here. how you do
When does that happen?
So of course, there's a lot of studying to do. Yes.
Yeah.
But don't get me started on it. We want it to be an entertaining podcast, not a depressing podcast. Right?
You just told that you came from an operation and a surgery. What was it about?
Yeah. So basically, urologists are supposed to deal with everything which is related to urine, and since I'm an andrologist, we also deal with problems that men face in particular. Right?
Okay,
So
right.
the reproductive. So today our case list was somewhere around extracting sperms, and then there was a varicocele surgery, and then there was also a stenting for a patient with failed kidney. So stuff like that. Yes.
Oh. So I think urology, I also got to know about the same yesterday itself.
Yeah.
And because I feel everyone knows what a gynecologist does.
Yeah.
Very few people, being guys, we don't really know about who to go to, who to question about our
Reproductive health.
reproductive health.
Right. I appreciate it. So basically, that's what Best for Him does. So actually,
Yeah. That's the magazine.
That's
Yeah.
the magazine that talks about men and their issues,
Hmm.
because that's what I deal in day in, day out.
Right.
Men and their issues, right? But then all these issues, the real problems, they also have a psychogenic basis or psychological basis, and that comes from the deep-rooted problems in the society.
That's true.
And
yeah.
of course, the only way to deal with it is awareness, and
Hmm.
that's why we started this magazine called Best for Him.
What does that do?
So best
Spread
for him talks
awareness.
about men and their issues or different domains, but we spice it up with lifestyle, with fashion, so that people can read it,
Wonderful.
and then they also get to know about health.
Mm.
So health, lifestyle, and we particularly focus on mental health and intimate health and overall holistic well-being.
What is that like one thing that is very common in men, but they don't speak about it, about their reproductive health, like which is found
I
in
think most
almost every
commonly
man.
everyone can face it is masturbation guilt. You just feel you've done too much of masturbation, and now you're gonna have a problem.
Yeah.
There are like various issues. Men can take up any issue and bloat it up because they don't talk to anyone about
Yeah.
it. So sometimes people just have a fear that they can never be a father. Like it's just a simple example, right? They would fear that they may not have good sperms,
Okay.
right? So these kind of fears are
Prevalent.
there in men, right? Which are baseless fears. Of course, nobody can say that I'm gonna, but they just learn about it, and then they would think that they would also be suffering from it. It's something which is very common with MBBS doctors. When they're in the second year, they start learning about diseases. They start feeling that they have all the diseases.
Oh.
It's a general human tendency. If you get to know about some symptoms, maybe like I say lethargy is there, and one of the symptoms is fever, and then you feel tingling in your soles, then you will start feeling it, and you might think that I have this problem, right?
The Google search basically.
Yeah.
Now it's become very more common now
Yeah.
because of course, thanks to the internet. But so considering that, so these are some very common things. They are not problems in the organic domain. They don't exist, but we've made it in our minds because we don't talk about it, or there's not enough awareness about it. And sometimes men are very rarely, they would not talk seriously about it, so they would just belittle each other and try to make small talk out of it by just teasing a friend around it or stuff like that.
Do you think of course that's because of the environment that we live in, but that is, of course, I think more in India than outside. Do you feel that way?
So having practice in more than India, I believe that it's not that India is the only country where we have cultural beliefs. It's prevalent in European countries as well. It all depends on the mindset of the person inside. If he's an extrovert, if it's an introvert, and how they access the information.
Right.
It's difficult to access information in the right way. It's available, but you need to know where to find it.
Of course. And
and that's a problem so that's why we need more reliable resources. For example, Best Film magazine. Right?
Yeah.
So you talked about masturbation. Like a lot of guys have this question, like, is it healthy? To which extent it is healthy?
How often should you
how
do
often
it?
should
Right. So we don't have a medical definition to what is healthy, normal, stuff like that. But what we would consider that this is a reproductive function. It's a physiological issue in the sense it's a process. And of course, it's completely fine from the scientific perspective, from the medical perspective. Now we have research talking about the fact that if you do it as commonly as it should be done, when you don't harm yourself doing it, then there are chances that you may actually reduce your prostate cancer risks also. Because this is again a secretion which has to be circulated. So body has its own way of kind of eating it up in case it's not used, but otherwise there is something called nocturnal emissions and all the other things. So if you ask me how much it can be done, that is very appetite kind of situation. It's like how many meals should you have in a day. Somebody would want to have 3 meals, somebody would have 6 meals, somebody would have 1 meal. It all is a personal preference. And typically I would say that there are always 3 things that I connect with when I say what is normal. It should not harm you, in the sense you should not harm your body while doing it or the organ. Secondly, you shouldn't be obsessed by the thing. So it should not be that you are not able to work and you're just thinking about masturbating. And third is that it shouldn't be done in places where it's
public.
Yeah, something like that. But so basically all these, if these rules are met, and if you are doing it in a healthy way as per what the desire of the body is, then we cannot call it something as pathology, right?
Okay.
It's normal to be doing masturbation.
You told about like obsession of doing it. So like, do you think like there are any external factors that are like boosting that obsession in men?
So I think now, of course, we have a lot of exposure.
Wrong exposure is what I would like
Right,
to
right,
say.
right.
Yeah.
So that's one of the reasons, that the easy access, and then of course things would keep coming, because that's how the internet works, right? It wants to give you more of what you were looking for, and that's how people might get so much exposure and in such an easy way that, of course, it's very common to.
Is it impacting like anything for like if a person is sexually active, let's suppose, but is still obsessed with masturbation, like does that impact the both?
Right. So basically, it does, of course, because first thing it does is that it's a made up thing, right? So
Yeah.
if you see a movie, say maybe a Hollywood or a Bollywood movie, and you start acting like the hero and start jumping the buildings, right? Of course, you will harm yourself. It's pretty similar to what happens in the again on the reels around the subject. So what happens is that you start to get exposed to unrealistic times, right? So you would find people who are doing it for 30 minutes, 60 minutes, and they would expect that that is how long they should also be. And then of course there's a objectification of the partner's body as well, because that's not how real life bodies are, right? So they are made up, they're made up, right? So you kind of do not find them as attractive as you would find the actress, right?
Also,
and that makes you lose interest in, right?
the
So you start
relationship.
comparing on the wrong foot, I would say.
Absolutely.
Like you mentioned about the timing thing. Like what is the general timing?
Right. So basically,
which
that's
is average.
So
like,
we have international societies on sexual medicine which define these things. So anywhere between 2 to 11 minutes is what has been figured out. So, but average is about 2 to 5 minutes of penetrative intimacy, right?
okay.
So once you've penetrated, then usually you can last between 2 to 5 minutes.
Right.
That's normal. Anything less than 2 minutes becomes premature ejaculation, so to say, which is also called PME or PE. And that's when you can see somebody like me, who is an andrologist, means a urologist who has done his training in andrological disorders, and then they would be the right people to guide you on what is to be done.
Right.
Okay. Like how common is like premature ejaculation?
Actually, statistics say 1 in 3 people. So I don't know who
Oh.
amongst the 3 of us.
Okay.
So I want to also ask, the masturbation that you're talking about, for guys, very open conversation. We tend to go to porn and we tend to masturbate via that particular source. While for girls, it's a little different. For them, it might be just an experience of them being alone or doing whatever. But for guys, we feel we need something for that for masturbation to happen, mainly
As an aid.
as an aid. Yeah.
Because we have easy aids available. They were not available many years back, but it was still happening. Right?
How should one guy masturbate without watching porn?
That's not a medical question in the first place.
Yeah.
That's
Tip.
something that anybody can answer. But basically, you have to understand just a good concept that there's no, so whatever we are doing in the act is all processed by the mind, right? There, all the action happens. So even if there was something, then your eyes would take that signal to the mind will process it. Similarly, if you hear something, then the ears are going to take that to the mind and it's going to process it. And that signal travels down the spine onto the organ, right? So, so ultimately it's the processing in the mind, and ultimately it's your own creativity, which, is the replacement for an aid, so to say, right? So you have to be creative about it.
Like you mentioned, a lot of men have fear of that their sperm is not that good. Like, so what defines the sperm good or bad?
Right. So basically, by looking at the semen, you cannot say anything, except for that if there's a foul smell, or if it's too red or too yellow, or there is some sort of pus, or it's very thin. But then that's also very gross estimation. So you can only find out about your sperm, sadly, by doing something called a semen analysis.
Okay.
And that is done in laboratories. And ideally, the semen analysis, of course, has to be done in an IVF center by an embryologist. But for a gross estimation of how good or bad it is, you can also go for a pathology lab and get the analysis done. So there are certain values which the World Health Organization has defined in its
Hmm.
sixth manual, the latest manual, wherein they say that there should be a particular count, there should be a particular motility, there should be a particular morphology or shape of the sperm.
Hmm.
It should liquefy in a certain amount of time, and then there should be a particular volume of, say, about at least 1.5 ml to 5 ml.
Hmm.
So these parameters have been set by the World Health Organization itself. And basically, the semen analysis is then compared to these values. And these values we've derived on by, studying the samples of hundreds and thousands of fertile men. And then we
Okay.
found out what the normal variations are.
You mentioned IVF centers. Could you just elaborate what an IVF center does? And I think there are a lot of IVF centers opening in India also.
So I happen to head the center called Craft. It's an IVF center. And in IVF center, what we do is we help the couples to get a baby, right? So all those who've been trying naturally, they've not been able to conceive. So we assist them for reproduction. So every IVF center is actually, IVF is just one common word which has been
Mhm.
taken up by the
Mhm.
public. It's actually an ART center, Artificial Reproductive Technique
Right.
Center, wherein or you can say Assistive Reproductive Technique Center, wherein we are assisting couples who are not able to do it on their own. Now, this assistance can come just by counseling them.
Makes sense.
So, sometimes people would not know how to do it, when to do it, and how to plan.
Hmm.
And for there are ways to track the partner's cycle, and then also some kits available, or, and there are certain ways in which timings and stuff which you can do. And these are all accessible or easily available. Even if you search by my name, you'll find videos around it. Now, there we can counsel the couple, that this is how you have to plan your timing, and this is how often you should be doing it. And so from there, we can go ahead to something called as just simulation or improving the counts for them. But for the men, I would be taking care of them. I'll be finding reasons why their counts are less. There could be infections in the reproductive tract. There could be problems in the urinary passage, and urine and reproductive tract are deeply linked in men. So they're often, that's why the urologist is the person who would
Does that?
then be an
Yeah.
andrologist eventually.
Yeah.
And you don't have a direct andrology degree in India. You have to be a urologist, and then only you can practice andrology.
Right.
You can have additional training for andrology. But then basically, coming back to the point, the men would be helped by me. I'll figure out what issues are there. We'll do a few tests, and then we can give medicines or take corrective measures, and we can improve the sperm count. Similarly, for women, if we have low ovarian reserves or if we have problems in their cycles, then the gynecologist, who has done a special training in infertility called an infertility specialist, would be taking care of the partner, right?
Okay.
And then basically we'll try to sync everything together. Now, in case we're not able to sync, sometimes we may stimulate the ovaries so that there is an ovulation. Or similarly, we can help improve the sperm count. If that doesn't work, then the next step is an IUI, wherein we can inject the sperms after preparing them. So we process the sperm, concentrate the sperms in the semen, because semen is a fluid, and in that there are some sperms, right? So we can pool up the sperms together, and the best sperms can be concentrated and put into the partner artificially by a infertility expert, the gynecologist. That's the other thing that we can do in our IVF center. Then after that, what we can do is we can also physically remove the eggs from the woman's body, because for men, their gametes are anyways coming outside the body, right? So the semen is ejaculated out. It has all the sperms. But for women, the entire process is internalized. You cannot catch a hold of the egg. So that is done by stimulating and then removing the eggs separately through an ultrasound and through a very small procedure. Now, then what we do is we make the egg, get in touch with these sperms in a lab environment, in a petri dish, at the right temperature, in the right environment. So then the embryo will form. And this embryo is then selected, made to grow a bit in our incubators, which are very expensive incubators, and then made to it's put back into the womb, which is a process called ET, embryo transfer.
Is this test tube baby?
Yeah. So basically, this is categorized as test tube baby, and this is what IVF is.
Okay.
Right. The IVF is just a small part of all the reproductive assistance that we can do. But sometimes what happens is we don't find as many sperms also. We can find the egg, but we have very few sperms, or we don't have sperms. So in that case, what I would do as an andrologist is go into the testis, find some sperms, and make them physically get involved with each other under a microscope. Now, that's the highest possible technology, which is called ICSI. wherein we are basically injecting the sperm by ourselves with a very, very fine needle, which you can't even see, into the egg at the cellular level, and then creating an embryo, making it grow a bit to a stage where it can be transferred and independently it can grow, and putting it back into the womb.
Like
So that's what the IVF center does.
it is
God.
anywhere related to surrogacy.
Surrogacy, what we're doing is that there are certain women who will not be able to, harbor the child by themselves. They may not have a uterus, or they may have the uterus removed. They may have been an injury. They may have been a cancer. And in those patients where there's no womb at all, there will make their own embryo from their eggs and from the husband's sperm, and then transfer that embryo into some other woman who is willing to donate their womb for the next 9 months,
Will the characteristics of the baby be off?
of the mother and the father, because the
Same.
womb is not affecting the
Right.
characteristics.
That's so
Okay.
interesting. That's interesting. Right.
Like you were talking about sperm count. Like the kind of lifestyle we have right now and the kind of things all men are indulged in right now. Do you think that lifestyle is impacting the lower sperm
Of course,
count?
if you've read the papers recently, our fertility trends are declining.
Yes.
right?
Yeah.
So it is said that the Y chromosome, which has about 50 genes, is
Yeah.
shrinking day by day, and the X chromosome, which is the female chromosome, has 3,000 genes still. So it is said that eventually, over many years, I'm not trying to scare our audience here, but over many years, what's going to happen is that this Y chromosome might shrink further, and it will cease to exist, which means there'll be no males in the world. Right?
Okay.
And that's where the moment of men's health starts, that men have to be preserved, they have to be taken care of. In today's era, men are living 5 years less than women,
Yes.
right? So they're dying about 5 years and early. And in Russia, for example, they're dying about 10 to 12 years earlier.
What are the reasons why of the death, early deaths?
Okay, so
And
we're going in very deep right now,
Yeah.
but let me first finish the earlier question, which
Sure.
was about declining fertility. So because of various environmental factors, because of various genetic factors, and because of lifestyle, you can say, there has been a general decline in fertility, right? So now we have more and more infertile couples, and there's more and more requirement for assisted reproduction. At the same time, also, we find that men are marrying later, the couples have babies later. So the fertility potential also declines because the time for the correct fertility has somehow passed.
What is the ideal age of a male and a female to get married and have a healthy baby?
So there is no ideal age as such, but it is said that peak of fertility happens earlier in women and a little later in men. But I would say that ideally the ages should be less than 30 for both of them. Right? But then I am not somebody who would want to give a particular age, and I would want to give our audience a spectrum. So anything beyond 22, 23 to say less than 30 years is the ideal age when you will have the maximum reproductive potential as a couple. Otherwise, you'll have to go for things like egg freezing,
I wanted to ask about that. About freezing eggs. I have seen in the foreign, like westernized countries, a lot of females are freezing their eggs earlier than and after some time when they get married and want to have kids later down the line after 30, because of course taking care of a kid takes a lot of part of your life. So what is that process like, and does that actually influence and affect the baby?
Right. So basically, I am not the expert to talk about egg freezing, but being in the reproductive side and having an IVF center where I'm working in, I can give you a fair idea. So basically, egg freezing based on the concept that women's eggs did deplete over age with time. So every woman is born with certain number of eggs, and they tend to deplete as the cycles pass, because in every cycle some eggs get lost, right? So in this entire process, if you want to stop the process of losing the eggs, or if you feel that we may not be harboring a baby at a particular age till very late, then what can be done is that we can remove these eggs after stimulating the ovaries, and we can put them in a cryo can, right, which is like liquid nitrogen, and then the egg would get frozen in time. Now this can be thawed. Thawing is a process where you bring it back to life, and then it can be fused with the sperm, and a baby can be made, and the baby can be transferred.
Okay.
right? So that's what egg freezing means. So for women who are very ambitious, who would want to give priority to their careers, and of course it's their life and everyone has the right to choose what they would want to do, in those women they can opt for something called egg freezing before the eggs run out, right?
So also, like, coming back to us men, we really don't talk about a lot of issues that we have, a lot of stress, a lot of, unsaid pressure as men in our society. That also, I am definitely sure it impacts our, testosterone levels, our sperm count, our fertility, capabilities of our fertility. And I'm really grateful that we're talking to you, being spreading awareness here about mental health, also men's mental health. How long do you think that process is going to take further down the line? Ki everybody in India at least respects that men are also important in the society. Men's health is also very important. Because we shy. I feel most of the men shy in telling others about our problems.
So that's the inherent nature of men, actually. See, if you were eventually going to have family, you will always think about the preference of your wife, the children. You would not buy for yourself. You would rather be happy buying for them. So that's how men are inherently right? So similarly, when it comes to all the other issues, we give preference to maternal and child health always, because we are somehow considering ourselves as the keepers of the family, right? The breadwinners or the providers, right? So that's how we've taken up that role. And now over the years, it has been deeply ingrained into us, right? And that's what creates the problem here. So I would say that the concept of men's health started in the US about 12 years, 13 years back. That's when the societies started working towards the cause. And then we adopted it somewhere. I remember we formed the Men's Health Society of India in 2012. And now it's been about 12 years that the society is working. Now I've taken up as the general secretary of that society for entire India, right? So what we realize here is that it's very, very difficult to create that awareness in the society, because one, that the society is still not realizing right now that it's a bicycle and both the tires are required to move. Right now, it's talking about women equality and giving women a chance, which is absolutely correct. But at the same time, it doesn't mean that you have to neglect the other tire, right?
Yeah.
You have to work on both the tires. So even if the society would believe that men do not need that much help right now in certain issues, there are many other issues where men need help. And we have to create an equitable society, right? So there are many issues like, for example, addiction, men not talking to each other, stuff like that, which requires an adequate attention from our side, which the society is talking about. So bigger problems with men, as you were asking also, just connecting the two questions together, why men are actually living less and why is their health not a priority right now. The genetics itself is one of the causes. Just what we discuss is that there are two X chromosomes in the women, right? And there's only one X chromosome in the guys. So if something happens to that X chromosome in the women, they have a separate one, a spare one. So it can still give you that information which is required for survival. But in the men, there's only one X. So if there's something wrong happening with that X, then there's no other X chromosome. There's a Y chromosome, which is completely useless. That the only use of the Y chromosome is to define that you are a guy, right? Okay. There's no other information in that chromosome practically. It's a useless chromosome. So from that perspective, you are at a genetic disadvantage from the very beginning. You're born with something less, right? As simple as that. And then if you look at the studies, even for babies up till 1 year of age, there is more infant mortality in men, specifically with respiratory disorders, with gastrointestinal problems, because their immunity is less. It has been said in science, where there's some references, that when there's a conception happening, when the baby is being born, more men are formed, right? In the sense, about 170 men are formed for every 100 women in the womb. But then most of the men die, in the sense the male babies would die more often than the female babies because of these genetic reasons. And then there's immunity is less, so they're dying also early, more in the first year of life. Okay. And eventually, again, you see all the stresses. If you see somebody fighting a war, it's the men. If you see a Zomato guy or a Swiggy guy running across the road, taking his hand, a life in his hand, that's a guy. If you look at construction workers who are in the high-rise buildings who are working without protection, they are guys. If you find somebody smoking and having substance abuse, these are guys. So guys as such are high risk takers. Of course they will have more morbidity and mortality,
Why
right?
do you think that is from the society since the beginning? Why
Yes.
has it been? Well, obviously, it didn't happen like in the last 200 years. It has been like this way since the beginning.
So I think that is where men have been chasing a Herculean image of themselves, right? So that
That
we are
male ego-
descendants of Hercules. So we're
Hmm.
like physically more capable. So we should be the one who will be doing this.
Hmm.
And women, on the other hand, have taken more quieter roles in the society, like taking care of the family, staying at home, being a homemaker, stuff like that. So that's the traditional role, and that's how it has been. But earlier, there used to be, we didn't have enough longevity because there were wars and there were droughts and there were famines, whatever. Like there were a lot of situations that we couldn't really appreciate this. But now we have statistics, so we know that there's a widening gap among men and women. But then coming on to other things also, even cancers, the morbidity is more in men. So there are many disorders which are, for example, prostate cancer. There are many things which are very specific to men. They don't happen in women at all. So there are a lot of reasons around why we have men living less.
What is like the best thing that a guy should do, the hygiene wise, so that there are like as less as minimum infections?
See, I
and
think one
everything?
of the other things that we could talk about to connect the dots here is that men don't go to a healthcare provider.
Yeah.
We as men's health experts, we believe that a visit of a man to the clinic is a golden thing because it never happens, right? He would come once and then he would not come again. So women, on the other hand, they have to come multiple times because they are forced to come to the healthcare during childbirth. So if we have a look at how many times a woman would come to a healthcare facility and compared to a guy, so the guy would come as a kid, as a infant to the hospital. That's where usually most of us would be born, in an institutional healthcare facility, or maybe a homemade healthcare facility. But that's where the first exposure to healthcare is. After that, the guy never comes to the hospital unless he's started having some debilitating condition or he's had a trauma or something like that. But women, on the other hand, they would want to come because they have had their periods, so they want to discuss it with the gynecologist, or they would want to accompany their friends and come to the hospital and then discuss their issues, or they would want to come because they've become sexually active, or they would want to come because now they have a pregnancy due, so they would visit during the pregnancy at least 5 to 6 times a doctor, and then they would have the second child, and by that time they are quite used to talking about healthcare
and aware also about their own body.
Yes, they're more aware about their own body, and they are easily talking about their periods with other women as well. On the other hand, guys don't get an opportunity to come. They can only come when they're accompanying their wives, and that time also they would be busy in, typically they would be busy with their office work, or they would be thinking of the kids, or have their own worries in which they are engrossed. So they don't really interact with healthcare, and that's again a point where the men's health divide comes in, because we're not actually connecting with healthcare and improving our lives. So that's one thing that we should be doing as men, to not fall into the regular trap, which is to see a doctor and involve ourselves in health checkups. So there are many ways in which we can involve ourselves. So something called as a premarital health checkup, which we offer. So even if you want to book a premarital health checkup, you can go to the Best Friend website and we can give you some specialists. There's a list of people who are taking care of a premarital health checkup. Now, what is a premarital health checkup? It's like a certificate that you are good to
Have
get
a
married,
baby,
right?
yeah.
So in the premarital health checkup, we kind of talk to the guy. We talk about all the fears that they may have around this, because as we discussed, men are always living with some sort of self-imposed fears, right? So we talk about them, and if somebody says, "No, sir, I feel that I won't be able to do it because I've masturbated too much," then we would talk about that. And if they have issues, for example, phimosis is a very common issue. The foreskin becomes very tight and they're not able to penetrate because of pain around that area, and people don't know about it many times because again they have not been taught all this, right? So those kind of things can be examined. We can see for any reproductive infections. We can go for a testosterone blood test, or things like a semen analysis, right? Rather than knowing later that you're not able to father a child, you can get over these fears. So this is something which you call as a premarital health checkup, right? This is something that can be an avenue for men to get in touch with healthcare.
Like
Similarly, we have executive health checkups. We have some geriatric health checkup. So basically, a health checkup is a good way in which you can interact with the healthcare, and that's something that you can do in the first place. Then talking about other general tips, to avoid any issues, I think not going into substance abuse is a very important tip. Not that guys are the only ones who are going into substance abuse. Now we have the other gender also having quite a few number of people who are into substance abuse, but this is definitely one thing which is preventable. Avoid drugs, avoid smoking, avoid alcohol as much as you can. Apart from that, I would say that the self-reliance on that we have as men, that we're going to be all right, nothing is going to happen to us, that invincible nature that we have, that mindset has to change. We have to understand that we're humans, and we are prone to illnesses, and we should be thinking about them. We should be talking about them. We should be discussing them with others. So the biggest enemy to a guy is the other guy, because if you talk about your personal thing, he's gonna just make fun of you. That's how men deal with somebody who is asking a serious question. They would kind of displace it with humor, right? So that's something that is really bad. That's something really bad happening in colleges, when you belittle a guy, a short guy, saying that you're short, your dad would be short. These things shouldn't happen, right? Men should be given an environment where their questions or their concerns are addressed by other men with seriousness.
Do you think this should be started from like school?
Right. So I think, of course, everything has to start from school. But I won't want to blame the school system as such for it. But yes, we need to work around it. So counseling sessions where guys can talk about their problems without being ridiculed, maybe in the supervision of adults, or giving them more awareness about problems that they may face. I think they're much needed.
What is that, like, one common infection or disease every men tend to have, like, around their reproduction system, which goes ignored? Like, even if someone has it, they won't be able to feel it, and they will ignore it. But later on, they will discover
I can't pinpoint to any one particular thing, but again, the common issues with patient comes to me, I think I can discuss that. So I think foreskin issues, as I said, is a very common thing that's often unaddressed, because we really don't know how much the foreskin has to be pulled, what is the frenulum about, and that's one of the things that we should be aware of as men around our reproductive system. Now, it's not an infection, but it's again a problem, right? The second thing is that you should be aware of is the prostate health, right? Because that's again, prostate is a gland which many men do not know about. In fact, we've done a lot of surveys on our YouTube channel. You'll find us having vox pop, and people are talking about prostate with a lot of you can say amazement. Is it something that men have? Like, many men do not know that the prostate is not there in women, right? Right. So prostate is a gland which is for men, right? The testis and penis are only in men, right? So similarly, the prostate forms our semen, basically a large part of the semen,
right?
And similar to the prostate, we also have seminal vesicles which collect the semen and keep it stored. So these are organs which we have not been taught about, right? Because we can't see them, so we don't know about them. Right. So prostate health is again something, because if you would know, the prostate cancer is now the second most common cancer in men, but then it's a completely silent gland. First is these lung and oral cancers, like things like that.
Even after breast cancer.
So we cannot equate it, but in men this is the second most common, right? So basically, this is an important organ for us. So prostate health, for example, there can be prostate infections that we should be aware of. There can be prostate enlargements that we should be aware of regarding our fathers. And when they grow older, say about like beyond 60 in the age group, which is a little more elderly, they have more chance of having prostate cancer, right? So for men, I think prostate and the foreskin, these are the most important two things which we
How can one avoid prostate cancer?
Okay, so basically, prostate cancer is again a lot of genetics, and I'm coming up with a book around men's health. So,
wonderful.
So we are trying to talk about that. But genetics has a huge role to play in our lives, right? For example, you must have seen there are some men who are never exercising, but they are still healthy. And you still have people who like in their 30s, they're doing exercise and on the gym stairs, they are falling and having a heart attack, right? So only exercises and lifestyle are not the things that, we should be concerned with. The genetics is the most important thing, right? What are we made of? What genes are we made up of? How much stress can our genes take? So these are non-modifiable risk factors, which means that we cannot really change our genes. We can just be more cautious if our genes are bad. So anyways, coming back to the question that, what can we do for prostate cancer? We really can't do much with the genes. But yes, if you've had a family history of prostate cancer, for example, if your dad has it or your uncle has it, then you need to get yourself screened. Especially you can have a baseline around 40. That's one time. And then after 50, 55, you can start having an annual or biannuals. Like once in 2 years, you can screen the prostate cancer through a test called PSA. Now, PSA is a prostate specific antigen. That's the full form. And the prostate cancer, basically, it doesn't show any symptoms. Only the PSA starts to rise. That's why we are not able to catch many of the cancers in time to save our men.
So there's a very common thing basically men do for fun, which is like they hit on the testicles sometimes.
Okay.
Like by a joke or something, by playing cricket or something like.
Right.
Do you think how dangerous can that be to someone's reproductive health?
So basically, if it's a significant trauma, it can be quite dangerous.
Okay.
A little trivial hit would not cause much problem because there are two mechanisms. One is that they're hanging loose, so they have space to move back. Second is the dartos muscle, which kind of tightens once you have a trauma, so it kind of protects the testes. But still, no fun doing it.
Of course,
I'm not
not at all.
But it depends a lot on the trauma.
Okay.
But of course, definitely should be avoided. And in fact, there's a common saying that men made those guards, the testicular guards, earlier than helmets. So, of course,
For a reason.
For a reason.
There's a very fun game when you enter in a lift, you have to knock.
Yeah.
Okay.
If you don't knock, someone can knock you.
Yeah. It's not a game.
It's not a game, but
You
it is
better
just,
stay away from
it is just
This happened in my college.
yeah, it just happened with me yesterday.
I didn't.
So I hope that, at least we can work on not having that game made more common through the podcast at least.
So that is one thing I
You
would
want to clarify that.
like. Do you
So
think?
don't worry, if you've not been hit too bad, you're safe.
Yeah.
And your
It's
future
okay.
generations also.
Like, how safe is like unprotected sex?
It's not safe. Of course, it's not safe.
But it's like it's not safe. I get it. Like there are two kind of semen. One is pre-semen,
Pre-cum.
and then there is pre-cum, and then there is main semen.
Right.
Is pre-semen or pre-cum as fertile as main semen?
Right. So then let's talk about how ejaculation emission takes
Yeah.
place, right? So first and foremost, when you have the feeling of having an orgasm, the body will prepare the tubes through which the semen has to pass. It's a
Okay.
viscous fluid, right? So how does the body prepare? Is by releasing something which is called the pre-cum, right? So this is secreted mainly by the periurethral glands.
Okay.
So these glands basically oil the entire urine passage, which is called the urethra, right? And those secretions are like, they are, you can say, like saliva. And they're 1 to 2 drops or 3 drops, right? So they would just be a very fine transparent liquid that will just oil everything, right? So it doesn't have any sperms.
Okay, it doesn't
Right.
have any.
So, but then now if you have excess of pre-cum, then it means that you may have some infections around your male accessory glands, the prostate, the seminal vesicles and all. So that's something that you have to be worried about. But at the same time, men are not able to differentiate when they're going to ejaculate after the pre-cum, right? So, of course, that doesn't really lead us anywhere in the sense that we cannot rely on, just the pre-cum being there. And then there's something called the coitus interruptus where you would want to stop the act when the pre-cum comes. So, some people kind of try to master it and they end up having, the pills.
Having?
Pills for not having the baby. Right?
Like,
Does that
The
work?
emergency
Does that
contraception.
work? Like, how dangerous is like it is Ipill basically? Which
Yeah, so that's one of the brands. So there can be any brand,
okay.
right?
Like-
So these are basically hampering the hormonal balance of the partner. So it's not something which you should be offering to your partner or forcing your partner to have on, or relying on your partner and the partner relying on the pill, right? So
Okay.
that's why I said that there is no safety in without safety, right? I would not encourage our audience to ever, yeah, because once it happens, then you should see the men who come to me,
Okay.
right? That this happens, and I'm like the marrow of my life has been sucked, because I have patients who've come to me about 50 to 60 times also with the same fear again and again, despite regular counseling, despite getting all the tests done. Now they have their unfounded fears of STD. They've spent their salaries in medical consultations.
Of course, STD is very rare.
Very real, yes.
Very rare, yes. And still, I mean, a lot of Indian people, I feel, are not aware about such problems that it can cause for a lifetime, and generational also, I feel.
So of course, if one man is spoiled, the entire family is spoiled.
Exactly.
Right?
So that can be prevented by protected sex.
Of course.
So, like, AIDS is a STD which doesn't have a cure.
Yeah, so we've come quite far now from that point where we said that AIDS has no cure. We can control it quite a bit, and many men are able to live normal lives, but it still is a struggle, right? You still have to be on pills for a long time. It's better to be avoided.
But the other STDs, are they also like life-taking dangerous?
Yeah, so if say certain STDs, which, like, for example, syphilis is one example where you can neglect it because sometimes it may not produce enough symptoms, and then you may then have a neurological problem, or you may have an aortic aneurysm and it may burst and you may die suddenly. So of course STDs can be fatal as well, but more important than that, it's more about men feeling guilty about STDs and not showing up, trying to take treatments from just the chemist. And that's where the importance of men seeing the right experts comes into the picture.
Okay.
Because men are exploited like anything, and sometimes when you do not see the right expert.
How real is post-nut clarity?
Yeah, of course it's a phenomena in a way, but I have different thoughts around it. So basically, what happens is some men would feel that they have not ejaculated, and their epididymis would feel, or their testes would feel a little heavy, or they would feel a little discomforting. And then once they ejaculate, then they would feel that stress is gone, or that discomfort is gone. But I would like to appeal to such men to think about male accessory gland infections, because if you have that phenomena where you feel discomforted when you're not ejaculating for a long time, and when the sperms are getting stored there, then you might be harboring an infection in those areas. And because of the infection, once the semen accumulates there, then it will cause you pain and discomfort, which goes away once you ejaculate, right? So I would not say that all of that phenomena is physiological. A large part of it can also be pathological. So it's better to see somebody if you have that kind of a feeling.
So in our
something which you call as blue balls also, for example.
Yeah, blue balls, yes. So, but the post-nut clarity, the thing that I was talking about was after having, let's say, a sexual intercourse. Mostly guys talk about that post-nut clarity as, for some guys, it is about realizing that the partner was not required in the first place, or they feel they're sufficient on their own, or feeling as if, they have what they need, and they can just move on in life, or need some time alone after having like a sexual intercourse.
That's what an orgasm is about, right? You had a epitome of pleasure, and then after that you kind of satisfied with the pleasure, right? And then you do not want to do it again, and you feel that everything is kind of sorted right now, and I need to focus on whatever I'm doing right now. But then that's very different from the concept of love and being loved and being in a relationship. And so I think that's not a very medical question.
Totally.
But yes, it's a phenomena, of course, and it's again something that men, the way men think.
Yeah.
Right.
Totally. And also one more not medical question related, but a lot of guys would want an answer to it. How do you deal butt hair?
Okay, so again, that's testosterone is the one which makes us grow body hair, right? And the more testosterone you may have, the more hairier you would be in the rest of the body, and of course, the baldness also comes eventually with high testosterone. Now, typically, there is no need to deal with butt hair unless you are prone to long sitting hours, wherein you can develop something called as the pilonidal sinus, right? Or if you can say that you're prone to fungal infections, or you are just too sweaty because of having more sweat glands in your area, which is again a genetic makeup of the body. So I would suggest that if either you should have a regular shaving in the area if you are prone to having a pilonidal sinus, or if you're prone to sitting for long hours, or you have had a history of fungal infections, then raising would be a very good idea. Otherwise, you can go for epilation. Epilation means that we use creams to remove the hair, right? The only issue with epilation is that sometimes the skin may be sensitive to the chemicals that the the cream would have, which is again something that you may eventually have to suit yourself. For people who are really bothered by it, for those who kind of keep getting infections because of it, there's something called as laser hair removal, which can be tried only in selected cases.
I think that would help a lot of guys.
Yes.
Yeah.
So what I wanted to discuss more importantly is men would show their problems to quacks, right?
Quacks are?
Quacks are not qualified medical experts, like
Okay.
like the Himalayan tent house, right?
Okay. So it's a thing.
Himalayan dawa khana, yeah, shafa khana, all those kind of things, right? And then what happens is that the men are exploited because those quacks would then look at which car that the guy come out of and then offer the therapy according to that. So men are exploited in the name of sexual problems, right? So that's an important thing that men should be guided through the podcast and whom should they show, and why the quack is not the right person.
Where can people find you if you can?
Not me, but
no, but like for
other
guidance.
That's a
audience or
separate thing that we can talk about.
Yeah, I just want people to know if they want to get consultation from you and your people.
So I would not promote it on the podcast to consult me, because I don't do podcasts for business purposes strictly. So we'll keep that question out of mind. But we can talk about, if men have a problem, who is the doctor that they should see? So that question you can ask me.
So who should a guy see if they want to get their body checked as a whole? As a man.
Right. So basically, if we talk about India, here we have very, very few doctors who are interested in dealing with men's problems. And by the nature of the medical science and how it works in India, you have a urologist who is trained to deal with all problems around men. Now, in the urologist segment also, you would have a urologist who would be dealing with kidney stones. You'll have a urologist who will be dealing with kidney transplant. You'll have a urologist who will be dealing with kidney-related cancers or urological cancers, for example, prostate cancer. And you'll have certain urologists who are dealing with female urology, certain who are dealing with children and their urology. So a very selected people in the urology segment would be dealing with andrology. So these guys can be called andrologists. So every urologist would be given a training or would know about andrological problems or problems that happen around men's reproductive organs, right?
Right.
But in case you would really want to see an expert, then you need to have somebody who is a urologist and who also does a lot of andrology, or either by special training in andrology, as in a fellowship, or somebody who is dealing with a lot of men day in, day out, and by experience they are an andrologist.
Right.
So going by a friend's reference who has seen somebody as a doctor for men, who is qualified urologist would be a good choice. Or you can just go and see a urologist, and they would probably either guide you to see somebody in their fraternity as urologists who are more keen on helping men, as who are doing more of andrology, or they would help you themselves.
Right. One last very big question I think I have is that the rise of microplastics in our consumption of food, in our consumption of daily life. Every child that is born is now said to have some percentage of microplastic in them. how badly is that affecting the entire generation that is coming and the generation that we are living in right now?
I think we're yet to see the bad effect of microplastics in person, right? But of course, we've had experiments in mice who were exposed to microplastics, and because we can't do these studies in humans, of course. So, for example, there was one study around polystyrene microplastics in mice, right? So we found that such mice had low testosterone, right? Because the microplastics had also penetrated their Leydig cells, the cells which form testosterone in the testis, right? And those kind of things would be harmful for men in general. So of course, microplastics have deeply invaded everywhere, and I'm sure we would see more cancers, we'll see more infertility, we'll see more hypogonadism, which we also call as low testosterone or ADAM or androgen deficiency of the aging male, these kind of things.
How can one avoid it? No one can completely, of course, in today's day and age. But what are the measures that one should take to avoid microplastics?
As much as they can.
I think you have to completely dissociate from plastics and anything which is touch plastics for that matter.
That is
which is very, very difficult.
Do you do that in your house?
Of course, as much as possible.
The Teflon pan.
We don't use non-stick.
Yeah.
Yes. Teflon is a separate thing.
Yeah, but that does come into play in microplastics.
So Teflon
It's like a coating.
is so there are studies around these things being carcinogenic, especially when edible things come and connect. So carcinogens and microplastics, they are actually a little different, but microplastics can also be carcinogens, and that's what so basically there are different substances. They are leading to common problems, I would say. So as much as possible, of course, as much as we can.
Okay, so to wrap this up, like, what is that one advice you would like to give any men who is watching this podcast?
One is that if you're having some problems, you should take some friend's help. If you feel your friend won't belittle you, otherwise you seek for professional help. It's easily available. So don't keep things within yourself. Go and see somebody, an andrologist, to talk about your issues. That's very important. Second is, if you are not able to find somebody who's reliable and whom you can talk to, at least be that somebody for someone, right? So if a guy talks to you about his problem, don't belittle him. Try and be supportive, non-judgmental, and try to actually help rather than just belittling it. I don't think that's gonna take, belittling is not going to take the problems away. And then the third thing which I think should come out of this podcast is that men should also more frequently see the healthcare professionals, as women do, right? Because men are not gonna live longer; they're gonna live less, and we should learn something from the opposite gender, which is to be more open about problems and to be more in touch with the healthcare facility, right? So even if that much can be made to learn through this interaction today, I think it will make it all worthwhile.
Definitely. Thank you so much for doing this.
My pleasure.
Lovely.
Thank you so much for
Got to learn a lot.
having us in your studio as well.
Yeah.
My pleasure. Thank you.
I think everyone watching this podcast have learned a lot of things about themselves and men around them. So if you are someone who is suffering, please seek medical and professional help. And please comment down below if you want to see such more podcasts. And if you have any doubts, you can comment down below, or you can reach out to him on his socials. We will mention those in the description. And please subscribe to our channel and like this video and share this with the other men. And take care. We'll see you in the other one.
Bye bye.
Bye bye.